SNOMED CT stands for the Standard Nomenclature of Medicine Clinical Terms. This was developed in 1975. The first version of the clinical terms, SNOMED CT version, was released in 2002. It's owned and maintained by SNOMED International and managed in the United States through the National Library of Medicine for the United States version of SNOMED CT. That's also available to U.S. users free of charge. The international version is updated in January and June, and the United States version follows with updates in March and September. These updates will always contain the international changes, as well as those that may be specific just to the United States. There is an online United States content request system available to submit requests for new codes, synonyms, or other changes to SNOMED CT. Changes can include adding new codes, adding synonyms to existing codes, and deprecating codes for concepts that may no longer be valid or may have been added incorrectly in past versions. SNOMED CT is used in a variety of ways. It is required to be included in electronic health records as part of meaningful use starting in 2003. It's also one of the recommended vocabulary standards in the CMS Measures Management System blueprint for a number of data elements used in quality measures. It can also be mapped to other coding systems to facilitate semantic interoperability. The structure of SNOMED CT consists of three components. At one level, there are concepts. These concepts represent clinical thoughts, and each concept has a unique numeric concept identifier that is assigned as the system-assigned code. This allows for clinical data to be captured and later accessed or aggregated. Along with that concept identifier is a description, which is the ability to link that human-readable description term to a concept. Concepts can also have several associated descriptions that are represented as synonyms. There are also relationships as a way that identifies linking concepts to other concepts whose meaning is related in some way. At the top level concept, there's a main branch hierarchy, and as you descend in the hierarchy, the concepts within them become more specific. In the clinical finding top-level hierarchy, these are the results of clinical observations, assessments, or judgments. They can include both abnormal and normal statuses, and this hierarchy also includes a concept for diagnosis. As an example of clinical, you can have something as a finding such as a headache, or you can identify that the patient has normal breath sounds as opposed to only identifying an abnormal status. The procedure hierarchy represents activities performed in provision of care. This is a wide range of concepts for things like invasive procedures, the administration of medication, imaging, education, therapies, and administrative types of procedures will all fall under that procedure hierarchy. So you can have an injection for administration of medication, a cholecystectomy for an invasive procedure, or the patient can have had speech therapy, which would also be a concept under the procedure category. Here's some examples of SNOMED CT and their structure. As I mentioned earlier, this is the code and concept for normal breath sounds. The next one is a disorder for benign hypertension. The following is a cardiac catheterization, which is an example of a procedure concept. And it's followed by catheterization of a left heart. It's also a procedure, but it's also an example of a parent and child relationship. So if you only know that the patient had a cardiac catheterization, then you could use this first cardiac catheterization concept. But if you knew that they actually had a catheterization of the left heart, which is a child under cardiac catheterization, you would assign or use this particular concept in its identifier. Another example of a finding would be the ability to transfer weight. And finally, an example of an environment concept is that identifying that it's a hospice environment. So if you're identifying a patient that currently resides in a hospice, you can use an environment concept from SNOMED CT. In Siren, in the Compendium of Social Risk Factors, they have several examples here using SNOMED CT codes, identifying whether their patient was able to obtain food versus unable to obtain food, if they are part of a homeless family, or suspected victim of child abuse, which is a situation concept, or whether they have a stress and an adjustment reaction disorder.